Hello, everyone. Hi, happy Monday. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our Monday, August 31st update on the impact of COVID-19 epidemic on Mobile County. Wow, the last day of August. Summer's just flown by. All right, across the globe, there have been more than 25 million cases of COVID-19 disease, with nearly 850,000 deaths. In the U.S., surpassing 6 million cases of COVID-19 with over 183,000 deaths. And in Alabama today, they're reporting on 117,152 cases of COVID-19 with 2,083 deaths. There was an important note on the dashboard, on the ADPH dashboard today, that a new lab was onboarded and sent a backlog of both positive and negative lab results, resulting in an artificial increase on August 29th, 1,297 positive cases from a single laboratory backlog. The patients knew that they had received their test results. It just that the lab result had not reached the state health department. So in our daily report today for Mobile County, we're showing 12,294 cases of COVID-19. That's an increase of 53. Around 2% of our cases are classified as probable and the rest confirmed, but we combine those together. We'll talk more about that in a minute. We've had 263 deaths. I believe that's 4 or 5 that have been added over the weekend. And the cumulative number of hospitalizations is at 1,768. That's a slight decrease, which I know seems odd because it's a cumulative number, but the hospitals manually enter that data. And on Sunday, a hospital made an adjustment to its Saturday's count. So that is why we had a slight reduction in the number of cumulative cases. So last week, around 539 COVID-19 cases were reported among Mobile County residents. This is about the same it was for the previous week. So we've had 2 straight weeks of less than 600 COVID-19 cases reported. On Friday, there were 102. On Saturday, 62. And then on Sunday, 53 cases added. Current hospitalizations was 104 for yesterday. This is the lowest number of people currently in the hospital with COVID-19 since July 7. So we know that our July pretty much blew up with COVID cases after a couple of holidays and some relaxation of movement restrictions. And then since our statewide mask mandate has been in order, we have seen dramatic decreases. So again, 104 in the hospital yesterday, the lowest since July 7th. So good work, everyone, wearing those masks and trying to keep those that are most vulnerable for hospitalizations and death protected. So our weekly expanded report has not been released yet. We're waiting on our partners who help us out with the map each week to get that over to us when they're done with some other important work. But in this weekly report, again, we're just over 12,000 COVID cases. That includes 11,980 that are laboratory confirmed and 216 that are probable. That's around 2%. We may start to see this probable case count increase as more and more use of the antigen point of care test people are picking these up as they become available, the machines and also the reagents, because it's a rapid test and can be done at the point of care. They're highly desirable. The antigen tests, the performance of those tests is different than the PCR test, and because of that, a antigen positive test in someone who is symptomatic is counted as a probable case. Still a COVID case, but a probable case. And then we have about 2% that have died with COVID, so our mortality rate or our death rate is holding around 2%. I just want to point out that 2% that died mean that 98% of our cases, people with COVID, are recovering from their illness. So we don't always publish that presumed recovered number, but 98% of our cases are recovering from COVID-19, and that's really good news. So just to mention again about the daily number of cases, the 14-day moving average is now below 80 per day, and that is the lowest since July 6th. So again, doing some really good work to try to keep the counts and the hospitalizations low. As I mentioned, 2 consecutive weeks, we've had less than 600 cases per week. We are still seeing most of the cases in that 25 to 49 age group. Hold on a second. Yep. So still the people that are most likely to have asymptomatic or mild infection, people that are most likely to be out and about going to work, to church, those sorts of things. So those of you who are moving about the community, please continue to, physically distance, wear your mask, wash your hands, stay at home when you're sick. All right, we're showing the total number of cases for the entire month. This closed out on August 29th, so it's a couple of days shy, but it still will be much less than July. So right now we're showing about a 22% decrease in the number of COVID cases that were reported in August compared to that really high numbers that we were seeing in July. Let's see. We're still seeing, a small number, a dozen or so deaths reported each day. This again is a lag measure, so our hospitalizations have already begun coming down, and I think that we'll see the number of people who have died reported to us each day that start to come down as well. And remember that 90% of patients who die with COVID have underlying medical conditions. So when you have underlying medical conditions, this probably makes you more vulnerable to infection, right? Because your immune system doesn't work as robustly as someone who is healthy and has no underlying medical conditions. So you're more likely to get infected. And then when you get COVID infection, if you have underlying medical conditions or if you're older, then you have a harder time fighting the illness. And the other conditions that you have sort of can make it a greater challenge for you to fight that infection. So when we say underlying medical conditions, we're talking about things like cardiovascular disease, diabetes, acute respiratory disease, renal disease, being a former smoker, being obese, being over the age of 65. These are all conditions that might make you more prone to death if you do get COVID. So again, only 2% of our cases have died, and among those, about 90% have underlying medical conditions. Our percent positive for the week, if you follow this report closely, you'll sort of squint your eye at figure 8 the way I did. The volume of PCR tests that have been reported to us continues to go down, and it was a huge reduction last week. So we think as college kids are going back to school and they're being tested through their colleges, that may be a reason that we're seeing a drop. Some of you may know that the State Bureau of Clinical Laboratories, the State Public Health Lab, is moving to a brand new facility. So that is somewhat reducing their capacity for testing, for doing PCR testing. And again, we know that as more and more of the antigen point of care tests come on board, or even the point of care PCR test comes on board, that that may impact the total number of tests that we see each week. We hear from some of our partners who are doing more point of care tests than PCR tests that their percent positive is much higher than what we're seeing with PCR. I think what's happening is that those people who are most likely to have COVID, right, that are sick with COVID symptoms, have been exposed, they're seeking out those rapid tests because they want to know, right away if they have COVID. And people who are seeking testing for other reasons, maybe they're asymptomatic, haven't been exposed, those are being sent to PCR labs that take a little bit longer. And we think that that's what's contributing to that having a very low positive percent positive lab results for PCR tests. And what we're hearing from our partners is a much higher percent positive in the antigen tests. So a little bit more data, a little bit more information on our data. The ADPH Risk indicator dashboard was refreshed on Friday. I think that Dr. Chavers maybe talked about this on Friday. Mobile County is showing in the low risk category. So again, most things moving in the right direction. So good work out there. All right. Let me answer a couple of questions and then I'll just stress a couple of additional pieces of information that I want to make sure stay in the front of your brain because they're really important. So we had some questions from the media responding to something that was tweeted this weekend about that only 6% of the deaths or so have no underlying condition listed, and that's about what we expect. I think in Mobile data, it's around 10% that we don't know if they had an underlying medical condition or not. That's not extremely alarming. It's not new. We've known for quite some time that the overwhelming majority of people who die with COVID have an underlying medical condition. Some questions about updates on children going back to school. So, a large majority, some have already started, some are going back tomorrow, either virtually or in person. We've gotten just some preliminary raw data from the state health department on the number of schools that are reporting cases of COVID in the state report card. And for the 5 days from August 25th to 28th, for Mobile County, there were 53 reports of COVID in K through 12 schools and 4 in colleges or universities. Someone commenting that they would like to see the number recovered. This was a strategic decision made by the Unified Command to remove it because we know that the data are underreported. So again, just remember that only 2% have died. So we presume that the rest are recovering, if not already recovered. An email from someone asking us to enforce wearing masks and adhering to the Safer at Home order to wear a facial covering when you're in public and you can't maintain that 6-foot distance. This is certainly something that we want to continue. It appears that this is having a real and dramatic impact on reducing the number of COVID cases, reducing COVID transmission in our community. And then I'm not sure if it was this person or someone else who was talking about seeing, significant drops in the number of cases, the percent positive, the number of hospitalizations. It looks like the number of deaths are starting to go down, and commenting that, we should point out that this reduction started shortly after the mask order. So yeah, 4th of July, that holiday we know was a big super spreader event. And we had, from that day until about 14 days, people who were exposed, would be getting sick. So I do think, some of the numbers that we're seeing now, the number reported, the number of hospitalizations, these are numbers that we have not seen since just right at or right before the July 4th holiday. So it's good to see that we're going in the right direction. All right. So just a couple of comments from our health officer who reminds us that he wants to thank everyone for your efforts as new infections and hospitalizations continue to drop. Just continue social distancing, wearing your mask, wearing them correctly, washing hands for 20 seconds, not touching your face, using hand sanitizer, maintaining that 6-foot distance. And we're coming up on the Labor Day holiday. We do not want to see a repeat of 4th of July. So please, whatever you're planning to do to celebrate the 3-day weekend, please make sure you continue to comply with public health recommendations and the amended Safer at Home order. Also, 4th of July, remember water safety. So we need boating safety. We need to make sure you have use your personal flotation device. Remember, if you're going to be around swimming pools, that you need an adult, and stay hydrated. And then also we're hitting we dodged a bullet last week with Laura and Marco, but we are in the peak of our hurricane season. So continue to keep your go pack ready, have a plan for evacuating, and keep an eye on the tropical weather forming in our oceans and gulfs, and have a personal plan. And then remember, we have had just one chicken that was a sentinel chicken that was positive for West Nile virus. So we know that the virus is out there circulating. So please wear repellent when you're outside. And then just 2 other documents to remind you, please make sure that you are adhering to the August 27th amended Safer at Home order. that does allow for some things that are new, like, for example, buffets reopening, but continues the mask orders and all of the restrictions on limits of occupancy and that sort of thing through through October 2nd, I think. I think it's through October 2nd. Okay, I'll get that right and tell you again on Friday. And then the other thing is, if you are affiliated with a school, you need to be using the purple school toolkit. The one that's all green is no longer current. Use the purple toolkit. Want to make sure that everyone out there is using the most current guidance from the state. So use the purple back to school toolkit and stay safe and be well. And remember, when you're wearing your mask, it has to go over your nose, right? So this is not effective use of a facial covering. This is still in violation of the health order. So please cover your nose, cover your chin, and try to have a mask that fits you snug on the sides of your cheeks. And so stay safe out there, and we'll talk to you again on Friday.